What is an advanced practice nurse? Registered nurses who want to advance their nursing careers can do so by continuing their education to become an advanced practice nurse or advanced practice registered nurse. Advanced practice nursing requires a higher level of education, a Master of Science in Nursing at the minimum. Through extended education, one can expect to gain a larger skill set, increased assessment abilities, the ability to plan for and implement care, and the competency to offer diagnoses. MSN programs also allow nurses to become an expert in a nursing specialty so that they can go on to treat specific populations or diseases. Advanced practice nurses exercise a greater level of autonomy in the areas mentioned above due to their higher level of education and expertise. Advanced practice registered nurses often make more decisions about patient care as they have the knowledge needed to do so. They play an expanded role in managing individual and group care. They also collaborate directly with clients and patients, offering advanced care to maximize positive outcomes. There are different types of advanced practice nurses, such as nurse practitioner, certified nurse midwife, clinical nurse specialist, and nurse anesthetist. In order to work in any of these positions, you must complete an applicable training program and pass the Board of Certification exam for that particular type of nursing. The first type of advanced practice nurse that we're going to talk about is clinical nurse specialist. A clinical nurse specialist is a type of advanced practice registered nurses since one must complete graduate level education and clinical training in order to practice. They will also provide a higher level of patient care and perhaps take in a supervisory role within a healthcare team. Clinical nurse specialists must begin their careers and gain experience as registered nurses before they can transition into this advanced position. Once additional schooling of at least a master's degree and other requirements are met, clinical nurse specialists take up work in one of many highly specialized areas. A clinical nurse specialist, as indicated by the title, specializes in a certain area of medicine. These areas include setting, where you may earn your specialty depending on where you work, such as in a clinic, in critical care, or in the emergency room. The second one is population, where your specialization may link to the population you serve, such as children, women, or the elderly. Disease, where you may choose to focus on a specific disease or group of diseases, such as cancer, heart disease, or diabetes. The third one is health problem. If you choose to specialize in specific issues such as pain, wounds, or stress, you may specialize in a health problem area. And the last one is care type. You can specialize in care types such as psychiatric or rehabilitative if you wish to work with a specific type of patient undergoing a specific health condition. Clinical nurse specialists, like all the advanced practice nursing types, do also provide primary patient care to those under their scope. As of May 2017, the average base salary for clinical nurse specialists is $97,511, according to SalaryExpert.com. Clinical nurse specialist earnings can vary depending on the specialist unit and employer.
Out of the bed though?
Oh, yeah. I mean, he walks around normal.
Okay,
Yeah.
all right. Well, I want to make sure because last time we had to put him in a special. We're level 1 trauma center. We're a referral center, so we get the worst of the worst.
She'll check and see. We'll get you something soon.
As CNS on the floor, we look at all kinds of things. I look at the quality on the floor. I do teaching and mentoring of the nurses. I do consulting if they have questions about pressure ulcers, about fall risk patients. If I don't have the answer, I can find the answer. So it's not always that I have the answer, but I can find it and I can work to get it. How are you? I'm going to go see him real quick if you don't. As CNSs at IU Health, we are here to advance nursing practice system-wide. It's our job to give direct care nurses all the support and every resource possible so that they can then elevate our level of patient care. I've worked here for 21 years, and I was a fellow with one of the older CNSs, had been here for a while, and she said, you make a list of things you're going to do that day, and if you get one of them done, you're doing good. Because what happens is you start down and everything starts happening. So you kind of work with what's going on that day. So you have a list of projects and things that you may be working on, but there's other stuff that's constantly coming in that you're working on.
Does he go to a facility?
Some CNSs have 2 floors. They have 2 areas that they cover. I cover this floor, and I do coverage for the Yellow Rose unit, which is hospice, which is upstairs.
She brings to the floor a lot of experience. She does know what a nurse goes through. Even though it's challenging to be a better nurse, she kind of helps bring you to that next level.
Let's just watch and see.
That's what I think we try to do. We empower the nurses I want them to think this on their own. I don't want to I can't be here all the time. So I put things out there and I help them so that they can do it themselves. I'm doing what's right for the patients. And I feel like I'm doing the right thing for the nurses. And I want any of them to feel like if they had a patient on this unit, they would be comfortable with that. So you get to work with the nursing staff, you get to work with the patients a lot, you work with the physicians, you can do it all.
The second type of advanced practice nurse is nurse anesthetist. If you're a registered nurse looking for more autonomy working with patients in an operating room, intensive care unit, or surgical facility, then becoming a certified registered nurse anesthetist might be the perfect job for you. CRNAs are advanced practice registered nurses who administer anesthesia and other medications. They also monitor patients who are receiving and later recovering from anesthesia. CRNAs have acquired a master's degree focusing on anesthesia, completed extensive clinical training, and passed a certification exam approved by the National Boards of Certification and Recertification of Nurse Anesthetists. This type of advanced practice nurse provides anesthesia to a wide range of patients in a variety of care settings. They are certified to provide a full spectrum of anesthesia care, including for surgical procedures, and may work with healthy to very sick individuals of all ages and all levels of acuity, including patients who cannot give consent or in life-threatening condition. CRNAs are some of the highest paid RNs in the field. CRNAs made between $105,400 to about $242,000. With the average annual salary being approximately $157,000.
Nurse anesthesia is the profession where we provide sedation, we provide anesthesia, and we provide pain relief to patients that are undergoing surgical procedures.
A common misconception is that CRNAs practice under the direct supervision of someone. In some settings that is true, but throughout the United States, CRNAs can practice independently in a variety of settings.
So that can be in a large medical center or even a doctor's office.
There's really so many positive aspects about our profession. Most people, their first question is, how much money do you make? There's no real exact answer for that except for you get paid very well for what we do.
And I love the ability to be able to be there for these patients in probably some of the most anxious and scary times in their lives. It takes a lot of communication to be able to, in 5 minutes, talk with these patients and get them to trust you and realize that you're there to help them out.
I get to take somebody's day that is full of fear and anxiety, and I get to take that all away.
Probably one of the greatest challenges is just going through the schooling process. It's very rigorous and very demanding and takes a lot of time and effort. And if you don't have drive and work ethic, it's going to be very difficult.
On some days, you have to be able to cope with a really sick child or a person that dies on you in the operating room. On some days, you have to be interrupted at home. Sometimes your family life gets disrupted. But all in all, those are just kind of things that you just sign up for. My profession requires a variety of skills. You need to have good people skills. You have to be able to deal with patients. You have to know how to deal with operating room staff and surgeons. You have to be able to think clearly on your feet. There are so many complex things that we do, and you have to be able to handle pressure.
I think the moments that remind me the most why I'm in this profession is when I wake my patient up and they ask whether or not we're going to get started on the surgery. As well, my preoperative assessment of the patient. That's really my time to be able to connect with the patient. And a lot of times my ability to pray with my patients and ensure that they know that it's not just me taking care of them, it's God too.
The nurse practitioner is a licensed clinician who focuses on managing health conditions and preventing disease. NPs can diagnose illnesses, prescribe medications, do physical examinations, and provide counseling and education. The NP can focus on primary or acute care and specialize in many areas like pediatrics, family practice, and gerontology. Academic preparation. An NP will need to complete a graduate nursing program that focuses on his or her chosen population like pediatrics or adults. A master's degree or a doctoral degree is needed to practice, along with advanced clinical training. Licensing and certifications. After the NP graduates, he or she will need to take a national certification exam. Passing is necessary in order to qualify for licensure as an NP. Additional certifications that NPs can pursue include dermatology, oncology, and hospice care. Practice settings. NPs provide high-quality care in many types of settings, including clinics, hospitals, nursing homes, and public health departments. Current practice challenges. Some barriers exist that limit NP practice. The first one is state practice and licensure. Practice laws vary per state. Therefore, some NPs may not have full practice authority. Secondly, we have physician-related issues. Some physicians believe that NPs are incapable of providing quality, safe care. Additionally, there is a lack of knowledge of the NP scope of practice, which has been a barrier to collaboration. Professional contributions. NPs make up the most rapidly growing body of the primary care workforce, and research has shown that they provide great quality care at a lower cost than comparable services provided by others.
I chose to become a nurse practitioner because I was really longing for that continuity of care that was lacking in the acute care setting or inpatient setting. My typical day as a nurse practitioner starts out about an hour before I start seeing patients. So I review lab work, any diagnostic studies, any referrals that need to be completed, calling any patients back that need to be called. And then, of course, the majority of my day is seeing patients, doing physical exams, follow-ups, sick calls. And so the differences between what I did as a registered nurse versus what I do now as a nurse practitioner, the main thing is now I diagnose my patients' conditions, I prescribe medications, I order and interpret diagnostic studies, and I also have the opportunity to refer patients to other providers. So as a family nurse practitioner, we get to take care of the family, and there's not many specialties nowadays that get to take care of a baby that's just a few days old all the way up to someone who's in their 90s. So Loma Linda University School of Nursing's Family Nurse Practitioner program is different from other programs in that it incorporates wholeness as well as spirituality. I've been taught the tools to pray with my patients and to incorporate mental issues as well as the physical. As a family nurse practitioner, I had the opportunity of meeting a brand new family, and so it was a couple who brought in one of their younger children, and so I had the opportunity of sitting down with them as a family and talking to them about their issues and then examining them individually and then bringing them back together and educating them as a whole, and that's something that's really important as a family nurse practitioner.
The Certified Nurse Midwife is a licensed healthcare provider who specializes in women's health and childbirth. They assist in normal pregnancies in comparison to OBGYNs who manage high-risk pregnancies. In addition to delivering babies and providing prenatal and postnatal care, nurse midwives are involved in primary care. Examples include gynecological checkups, nutrition counseling, and patient education. Academic preparation. A master's degree or a doctoral degree is needed for entry to midwifery practice, and these programs typically take around 2 years to complete. Licensing and certifications. After the midwife graduates, he or she will need to take the Certified Nurse Midwifery exam, which is offered by the AMCB. The exam covers topics like antepartum, postpartum, newborn care, and primary care. After he or she passes the exam, they would have to apply for state certification. Practice settings. Midwives provide high-quality care in many types of settings, including homes, hospitals, and birth centers. Current practice challenges. The demand for midwives is increasing because more mothers are interested in having midwife-attended births. More educational programs and midwife preceptors are needed to meet this demand. Another challenge includes feelings of demoralization induced by both their patients and their supervisors. For example, sometimes a patient and family blames a midwife for maternal death or stillbirth. Professional contributions. Nurse midwives are known for their contribution of lowering infant and maternal mortality, premature births, and low birth weights. Additionally, research has shown that midwives have lower rates of cesarean births and lower use of anesthesia in comparison to physicians.
No, we really have the best.
Cute as a button, 2-month-old Shanti and mom Shira are back for a visit at UCLA. Shira and her family were guided through baby Shanti's delivery with the help of nurse midwives, a growing trend among birth options here at UCLA.
You know, I had things in my mind. I imagined, it would probably be like this, and it might be like this, and this experience I had in my life, but it was like times a gajillion anything I ever imagined. It was just the biggest, most intense, wonderful, amazing, wow experience ever.
Shira Harton and her husband Diego came to us when they first were pregnant, hoping for a different kind of birth. They were hoping for an unmedicated, natural birth, and they also wanted the security of being in a hospital.
UCLA is one of only a handful of medical centers with midwife programs operating within the hospital setting, with doctors, including anesthesiologists, at the ready if needed. Midwives provide pre- and postnatal care and assist with a delivery that is both natural and safe.
Everything was explained to me, so she was there all the way, all along, she, encouraging me. And, when the going got rough, she remained level-headed, but still with a warm heart. So it was a perfect combination.
I think our statistics speak for us. We have a low C-section rate, we have a low episiotomy rate. And again, we want to be partners with women, and that's what they're seeking. They want people that are going to talk to them about the ideas that they have, the things that they're reading, and it's their birth, and they want somebody to come along and partner with them.
I think the midwives here are just really amazing, and they spend a lot of great time with their patients, and their approach to obstetrics is really unique and wonderful, and I think we have a lot to learn from them, and we definitely support them 100%.
Aurelia and her husband chose the UCLA midwives for the delivery of their new baby, too. At a healthy 7 pounds, 8 ounces, he is just 1 day old.
The midwives really walked me through the process. It made me feel supported and able to do it.
I thought it was incredible. We didn't use midwives before, and I wish we had used midwives for our previous two because it allowed my wife to be really relaxed, supported. They let her use different techniques and approaches.
The success stories of the midwife program at UCLA have led to a rapidly growing practice. The program just celebrated its 5,000th birth. And Shira and her family are already looking forward to the day she'll be back to UCLA for baby number 2.
All of the staff tries to provide that dream birth that the couples are hoping for. That's the unique aspect of the giving birth at UCLA.
Hi, my name is Anna, and I'll be talking about the doctoral programs in nursing. We're going to split this section by talking a little bit about the history that includes important dates and some recognitions that help progress what the doctoral programs are today. And we're also going to compare and contrast the three types of doctoral programs. These include the Doctor of Nursing Practice, also known as DNP, Doctor of Philosophy in Nursing, which is PhD, and Doctor of Education, which is EDD. So with that said, we're going to start with the history of doctoral programs in nursing. So with this slide, as you can see, there's a picture of a university campus, and this campus is known as Columbia University's Teachers College. So with the history, the first formal doctoral education for nurses began here at this university, Columbia University's Teachers College, and it was in 1910 that it started having doctoral education open for nurses. Some more information about the history of doctoral programs that are mentioned in our textbooks are, for example, in 1932, the first student was awarded in the doctorate in education. In 1934, New Yorkers University had a first PhD program for nurses. And then around from 1943 to 1953, there were no new doctoral programs given for nurses until 1975, where more universities began offering more doctoral programs. But in 1950s, towards the end of it, it was documented that 36 total doctoral degrees were awarded for nursing. So you can see how it expanded and tried to grow as there is a high demand for DNPs now, because it helps us prepare nurses to become leaders in healthcare systems and experts in advanced nursing practice. Currently, the growth of DNP programs also have been remarkable. For instance, in 2017, 6,090 nurses received a DNP degree from accredited programs in the United States. Now I'm going to go more in depth about the DNP programs, which again stands for the Doctor of Nursing Practice. It emphasizes on clinical practice-oriented leadership training, and although it's not required for all advanced nursing jobs to have a DNP, it does help you move into more nurse leadership roles because they help advance your career on the clinical side. DNP is also known as a practice doctorate, so they use more research to influence your practice in a clinical setting. So why should you have a DNP? Well, a DNP is, like I said, high in demand for nurses, and because there's an aging population, increased healthcare issues, and a growing need for highly trained nurses, it would be recommended or suggested for nurses to try to earn a doctorate degree. It also generally comes with a better pay, which is some of the reasons why nurses try to pursue this doctorate, but nonetheless it does help positively impact their local community and the medical field. When considering to take a program like the DNP, it does take on average 4 to 6 years to complete because you spend a lot of time focusing on the area of research that you choose. Although, despite that, you will learn how to extend your skills beyond practical, hands-on nursing and be able to experience and expose yourself to a scholarly and research area. And depending on the program, you can go in a variety of areas such as research methods, statistics and data analysis, evidence-based practice, the history and philosophy of nursing science, and leadership skills. And with that said, it all just helps strive to improve healthcare systems and work with patients from different populations and within the community. With this last slide for the DNP portion, I will be also going more in depth of what they consist of. So with the core curriculum, they do things such as translate research evidence into nursing practice, and they do also healthcare policies that can include budgets, financial management, and leadership theory. The application prerequisites is that you must have a Bachelor's of Science in Nursing or a Master's of Science in Nursing. So either one is okay. And they also do credit hours for the DNP. Usually there is about 70 to 95 credit hours for those with a BSN, and they also have 1,000 clinical hours. Although with an MSN, you might just have to just do fewer required credit hours. So depending on the degree you have, this can determine how many hours needed for your education and program. The research that they focus on is statistics and theory, and there are some online programs available for DNP in addition to on-campus programs, but online programs provide a lot of flexibility and allow other individuals to work according to their schedule. But the benefit of on-campus programs also helps you be more interactive with your peers in person and also your instructors or teachers and such. When it comes to final projects, they also have a consistency of clinical paper or presentations and other practice-based projects. And once you get your DNP, there are some typical postgraduate employment opportunities that can include leadership in nursing practice, management positions, healthcare policy, administration, or government positions, and academics in practice-based nursing programs. So with that said, there's just a lot of variety of things to do with your DNP, but nonetheless, it helps you practice clinical-oriented leadership and also allows you to further your research skills and analytical thought processes.
The DNP program here at Marymount will help me to be a leader of change, an innovator of change versus being a follower of change. Coming up with some evidence-based ideas and be a leader versus being a follower.
The faculty member at Marymount have encouraged me to look at my specialty areas, HIV and cardiovascular disease.
As a clinical nurse specialist in Marymount's DNP program, my focus of education is health literacy.
It's given me the confidence to move forward with the healthcare reform. It's an exciting program. The faculty, they're really supportive with the innovative model of care. They allow us to pursue what we want to do in our clinical practice.
They give you information on a lived experience versus something that they've researched or I've never experienced before.
The program at Marymount has been very convenient and easy because they offer the classes once a week.
I see the DNP program helping me in my career by facilitating my education so that I can become a change agent in the area of nursing practice to promote health literacy in underserved populations.
I'm not very good on online learner, so just having a face-to-face with a professor is very beneficial for me. Immediately after graduating from the DNP program at Marymount, I have plans to pursue leadership and more of administrative duties within the military healthcare system.
Marymount's DNP program is excellent.
Exciting.
Innovative.
Invigorating.
It's gratifying, it's memorable.
It's challenging.
It's sustainable.
Life-changing.
I've learned things here that will last me the rest of my career.
Hello, my name is Sally, and I will be talking about the PhD programs. So PhD stands for Doctor of Philosophy, and while we saw that the DNP degree focused on the clinical practice-oriented nursing as it applies to patient outcomes, the PhD emphasizes scholarly research and inquiry. So the primary difference lies in practice and outcomes, referring to DNP, and research and science for the PhD degree. So a PhD degree can take a very long time to complete, and people complete the program in about 4 years with transferring their credits and 5 years without. So for a PhD, a master's degree is preferred, but there are some programs that accept BSN applicants. In regards to the credit hours, around 60 hours are needed, and in contrast to the DNP degree, clinical work may be minimal for a PhD. A nursing doctor of philosophy degree includes very in-depth faculty-guided research. So most of the education takes place in class, but there are online programs available. So now I'll be talking about the PhD career tasks. And with the PhD, you can design, conduct, and evaluate original research, as well as generate or test theories. So the aim is to develop nursing science and analytical methods, and a person with a PhD collaborates with many other disciplines in design and conduct of research. And with a PhD, one can also contribute to healthcare policy, develop new nursing knowledge, and advance scientific inquiries. And career choices include nurse researcher, nurse scientist, policymaker, and author. So you can write your own books based on your research, and doctors of philosophy and nursing are thought to be great mentors for research.
A PhD in nursing is all about change. Making change on larger, increasingly expanded levels. So you can start in a community clinic and expand that to a hospital and then a hospital system. You can make changes throughout the city or throughout the state. All of these things really require a doctorally prepared nurse. Traditionally, among Latino communities, nurses are underrepresented. Healthcare providers of all sorts are underrepresented. And having received care in a community that was largely Latino, that really had a lack of access to a lot of basic services, made me feel like it was my job to get out there and make sure that those services were available, that they were culturally appropriate. I felt like I had something to add to the conversation about how people where I'm from would like to be treated. So I look at risk stacking, which is the co-occurrence of more than one chronic illness. And in this case, I'm looking at the co-occurrence of type 2 diabetes and also depression or anxiety among Latina women 60 and over. The status and access that you have here at UCLA really is a game changer. I've done a variety of programs both here in Los Angeles County and throughout the country, and this immediate recognition of UCLA as this respected, well-funded, well-supported institution where you're going to have some of the brightest minds that we have working on problems that are important to you. A PhD opens doors by completely abolishing any preconceived notions people have about nurses. When you walk into a room as a nurse with a PhD, there's an understanding and an expectation that you are able to function at the highest levels in an administrative position or in an academic institution. There is an understanding that you have achieved a base level of success that has to do with very rigorous methodology, philosophical approaches, an understanding of the state of the science, and an understanding of the gaps in the science and where your expertise is needed.
Finally, the last doctoral program that will be discussed is the Doctor of Education. You may ask, what is a nurse educator? The Doctor of Education degree is designed for nurses with a master's degree who want to become educators in either academic or staff development settings. It can take about 3 years to prepare to become a nurse educator. And a nurse educator leads changes in nursing education as they are to become a nurse educator, and the nurse educator leads many changes in nursing education as they are well prepared to be scholarly practitioners in their field. And they utilize the evidence-based practice guidelines, so they make sure that everything is up to date and that, you know, we are learning in an environment where we really think of the importance of safety. So lastly, to briefly describe the program requirements or the Doctor of Education degree, about 60 through 90 credits are required in addition to a master's degree and a cumulative GPA of a 3.0 to 4.0 depending on the program. And for clinical work, there are minimal clinical hours. It ranges, but in general, about 3 days in total is the maximum. And there are also hybrid courses that include online and weekend learning experiences for this degree. And typical postgraduate employments are to become an education administrator or training and development manager, such as in the hospital.
My name is Cheryl Brandt, and I'm a nurse educator. I'm a professor in the College of Nursing and Health Sciences at UW Eau Claire. I have to master not just one profession, I need to master two: nursing, education, because I'm a nursing educator. And the skills that you have as a nurse are not the same as the skills that you have as an educator.
I was delighted when I asked Cheryl if she would be willing to be the nurse educator to be filmed for this documentary.
The knowledge of my discipline in nursing changes over at an incredibly fast pace, and the skills and strategies in the education world are also changing at a fast pace, and I have to keep up. And so I'm taking continuing education courses as a nurse, but I'm doing continuing education professional development as an educator to make sure that I know what are the tools and strategies that I can pull into the classroom or pull into the clinical setting that reflect best practice, current best practice.
I think what you're going to see, you'll find to be exceptional, but I need to tell you, it is not the exception. It is the norm for our nursing faculty.
So this semester, I have had teaching assignments in 6 courses. 4 of them are undergraduate and 2 of them are graduate.
For each 1 credit that a student has for theory, that's about equivalent to 1 hour of class time. In comparison, in clinical, it's a 1-to-3 ratio. So you have 1 credit, but it's 3 hours of clinical. So if a faculty member has a 3-credit clinical that they're teaching, we're talking about 136 hours over the course of the semester that they're actually doing clinical time.
I share lecture responsibilities in a 3-credit graduate course. I represent Mayo Clinic Health Systems on some committees at the Mayo Enterprise level. And then I've had a couple hours of research team meeting with one of my faculty colleagues and our undergraduate research assistant. In the afternoon, I have attended University Liberal Education Committee meetings because I'm the college rep to the university committee. And then along about 3:30, I'm getting in my car and going over to Mayo because I have to read patient records and identify the patients that my students are going to be taking care of for Tuesday morning clinicals. On Tuesday morning, I get up early because that's my clinical morning with my second semester junior students. And so I leave the house a little before 5 o'clock. I head to Mayo, and I'm heading to a medical surgical unit there where I am with my 8 or 9 students. I've sent them their assignments the evening before, and I have updated information on the patients that I share with the students and kind of review and point out, okay, this is something you're going to have to do.
So when I get here, it's about 5:45, and I meet Cheryl in the nurses station, and then she gives me a pills, which is just kind of like a breakdown of what my patient's life is like and what's going on. And then her and I will discuss anything that we don't understand or anything that maybe needs to be clear.
And then I'm out the door, or just on the floor and pounding the pavement, so to speak, moving from student to student, patient to patient. I have a metaphor for clinical instruction, which is the metaphor of an air traffic controller. And I have 8, 9 student-patient dyads, and they all have to be kept in the air. And nobody crashes, nobody burns.
So whenever I have any questions about my patients or medications or anything like that, I ask her, and then she kind of just watches over me, makes sure I remember all the things that a senior nurse would remember. So she just is kind of my little guardian angel, I guess.
And anybody who knows med-surg nursing knows it's a constant state of flux, and you're dealing with a lot of different patients. You're kind of the jack of all trades when it comes to nursing. And so trying to help students negotiate those sort of experiences can be very intense. There's many times in the course of your shift or your time there with the students, you know, there's no time to eat, there's no time to drink, there's no time to use the restroom, because you're literally going from one thing to the next.
There has been a great shift in that sage on the stage to transitioning to active learning.
So I'm using more and more student small group activities and actual experiential things, care planning, case studies, and so I have had to learn a new skill set.
The amount of preparation that goes into being a good instructor is just so time consuming. We might have lecture for 2 hours, but it would be absolutely nothing for me to spend 20 hours preparing for that 2 hours.
I've had to find time out of the usual Monday through Friday workday times, like Saturdays or Sunday afternoons, to create digital content. Things like voice over PowerPoint or Camtasia built videos. Does it pay off? I think so. Students appreciate the digital content. We get positive comments in our course evals, but it's been a new thing.
Everybody's overextended. The workload is intense. And then there's also advising, because once again, we want to be there for the students, and the students' needs come first.
The expectation in the early 80s for faculty availability to students was pretty much confined to when are your office hours. We're still expected to keep office hours, but there's this thing called email.
It's actually kind of convenient to communicate with Cheryl. I just email her, we have her number, so if we need to call her, text her, anything like that.
Am I available to students on Saturday and Sunday? Maybe not technically, but then when I'm at home working and I have my Outlook open and an email comes in from the student, I'm going to answer it. You know, on the one hand, you could say, no, pretty hard-nosed about it, I'm off the grid. But I'm not off the grid because I'm home grading papers anyway. One of the things that UW-Eau Claire prides itself on is the level of availability of faculty-student collaborative research. And so that expectation means that we as faculty need to find time in our schedules to work with our students. And so I have needed to be, I've needed to carve out upwards of 4 or 5 hours a week, some weeks. And so that has been, I guess I would say, on the one hand, a wonderful and engaging and just kind of almost exhilarating experience, but it takes more time.
I would love to be able to say that the footage of Cheryl Brandt, who has been videoed for this documentary, was really somebody who is acting the role of faculty on steroids. But the reality is, she is what nurse educators are. Very multifaceted, multitasking individuals who are striving to stay at the top of their game in their nursing specialization and in their role as nurse educator.